So in this short video, we want to demonstrate how the quadriceps can contribute to medial and lateral stability at the knee. So the first case will be here on the left, where we deal with an external varus load or external adduction moment. So here we have the vertical ground reaction force, which is acting medial to the knee joint. And when that occurs, there's an external adduction moment. And that adduction moment causes the access point to be at the medial tibial plateau and the contact with the medial femoral condyle. So the patella tendon force, which is shown here, from the quadriceps is now lateral to the axis point, and so it causes an internal valgus moment, contributing to stability at the knee or closing of the lateral side of the joint between the lateral tibial condyle and the lateral femoral condyle. When we reverse this, or we note that the ground reaction force is now lateral to the joint line, now we have an external valgus or abduction moment. And so this shifts the contact point to between the lateral tibial plateau and lateral femoral condyle here. So now the force of the patella tendon is medial to the axis point and has a moment arm here. And so then the patella tendon pull causes an adduction, internal adduction moment or varus moment. So now we can look at clinically when this occurs or functionally when this occurs. So here's a typical walking trial about mid-stance. What you can see is essentially the vertical ground reaction force is headed up toward the body's center of mass, which is somewhere up here. And so typically throughout a single limb stance phase of walking, the vertical ground reaction force shown here sits medial to the knee joint, and therefore the contact point is between the medial tibial plateau and medial femoral condyle. And so typically the quadriceps pull would have the effect of opposing this external adduction moment, and then the quadriceps pull would contribute to the internal abduction moment. And we can see here that what can happen is if you have pelvic drop on the swing leg during gait, so this is the swing leg, this can increase the moment arm of the vertical ground reaction force. So this moment arm here is longer, okay, and essentially causing an increased adduction moment, external adduction moment here, which results in a greater need for an internal abduction moment, causing increase in the joint contact forces. We can also see another example here where when landing mechanics occur without the knees aligned with the hip and the foot, when the person lands, like this is shown here, jumping from this box, the ground reaction force again is going to be toward the center of the body. So here's the contact point on the ground. So if we imagine the ground reaction force here, so that's our vertical GRF, it could pass lateral to the knee joint. So here's the knee joint here. So it's lateral. So in this case, the ground reaction force would be causing a abduction or valgus external moment. And then what we would need internally is a varus moment or adduction moment to oppose the external load. So in this case, the quadriceps pull could contribute to stability by increasing the adduction moment because of the way the external load is occurring. So in summary, the take-home point is that the quadriceps pull can contribute to both an stability when there's an external adduction moment and stability when there's an external abduction moment.